How does a CT or CAT work? A computerized axial tomography (CT) or computerized axial tomography (CAT) scan combines data from several X-rays to provide a close image of structures inside the body. CT scans produce two-dimensional images of a slice or section of the body, but the info may also be a custom construct three-dimensional images. A CT scan may be compared to staring at one slice of bread within an entire loaf. CT scans are employed in hospitals worldwide. What is a CT scan? Share on Pinterest. A CT scan can help diagnose many sorts of cancer. A CT scanner emits a series of narrow beams through the organic structure because it moves through an arc. This is different from an setup, which sends only one radiation beam. The CT scan produces a more detailed final picture than an X-ray image. The CT scanner's X-ray detector can see many different levels of density. It can see tissues within a solid organ. This data is transmitted to a computer, which builds up a 3D cross-sectional picture of the part of the body and displays it on the screen. Sometimes, a contrast dye is employed because it can help show certain structures more clearly. For instance, if a 3D image of the abdomen is required, the patient must drink a barium meal. The barium appears white on the scan because it travels through the systema digestorium. If images lower down the body are required, like the rectum, the patient could also be given enema. If vessel images are the target, a contrast agent are injected into the veins. The accuracy and speed of CT scans is also improved with the applying of spiral CT, a comparatively new technology. The beam takes a spiral path during the scanning, so it gathers continuous data with no gaps between images. CT could be a great tool for assisting diagnosis in medicine, but it's a source of radiation, and it can potentially cause cancer. Uses. Share on Pinterest. A CT scan can detect abnormalities within the soft tissue. It is useful for obtaining images of soft tissues, the pelvis, blood vessels, lungs, brain, abdomen, bones. CT is commonly the well-liked way of diagnosing many cancers, like liver, lung, and pancreatic cancers. The image allows a doctor to substantiate the presence and placement of a tumor, its size, and the way much it's affected nearby tissue. A scan of the pinnacle can provide important information about the brain, as an example, if there's any bleeding, swelling of the arteries, or a tumor. A CT scan can reveal a tumor within the abdomen, and any swelling or inflammation in nearby internal organs. It can show any lacerations of the spleen, kidneys, or liver. As a CT scan detects abnormal tissue, it's useful for planning areas for radiotherapy and biopsies, and it can provide valuable data on blood flow and other vascular conditions. It can help a doctor assess bone diseases, bone density, and also the state of the patient's spine. It may also provide vital data about injuries to a patient's hands, feet, and other skeletal structures. Even small bones are clearly visible, yet is their surrounding tissue. CT versus MRI. The main differences between CT and MRI are: a CT scan uses X-rays, but an MRI uses magnets and radio waves. Unlike an MRI, a CT scan doesn't show tendons and ligaments. MRI is healthier for examining the funiculus. A CT scan is healthier suited to cancer, pneumonia, abnormal chest X-rays, bleeding within the brain, especially after an injury. A brain tumor is more clearly visible on MRI. A CT scan shows organ tear and organ injury more quickly, so it's going to be more suitable for trauma cases. Broken bones and vertebrae are more clearly visible on a CT scan. CT scans provide a more robust image of the lungs and organs within the cavity between the lungs. Procedure. The patient may have to abstain from food, and possibly drink, for a selected period before the scan. On the day. In most places, the patient will have to undress, usually all the way down to their underwear, and placed on a gown that the sickbay will provide. Avoid wearing jewelry. If the hospital doesn't provide a gown, the patient should wear loose-fitting clothes freed from metal buttons and zippers. Some patients should drink a contrast dye, or the dye could also be given as an enema, or injected. This improves the image of some blood vessels or tissues. Any patient who has an allergy to contrast medium should tell the doctor beforehand. Some medications can reduce allergies to contrast materials. As metal interferes with the workings of the CT scanner, the patient must remove all jewelry and metal fastenings. During the scan, the patient must change posture on a motorized examination table that slides into a donut-shaped CT scanner machine. In most cases, the patient will lie on their back, facing up. But, sometimes, they must lie face down or sideways. After one radiograph, the couch will move slightly, and so the machine will take another image, and so on. The patient has to lie very still for the most effective results. During the scan, everybody apart from the patient will leave the area. An intercom will enable two-way communication between the radiographer and therefore the patient. If the patient may be a child, a parent or adult may be allowed to face or sit nearby, but they're must wear a lead apron to stop radiation exposure. Expect in-depth, science-backed top-lines of our greatest stories each day. Tap in and keep your curiosity satisfied. Risks. Share on Pinterest. The doctor should explain why the scan is required, the other options available, and also the pros and cons of getting a CT scan. A CT scan involves a little, targeted dose of radiation. These levels of radiation, even in people that have undergone several scans, has not proven to be harmful. The chance of developing cancer because the results of a CT scan is assumed to be but 1 in 2,000. The amount of radiation involved is estimated to be around the same as someone would be exposed to in an exceedingly space of between several months and a number of other years of natural exposure within the environment. A scan is merely given if there's a transparent medical reason to try to do so. The results can cause treatment for conditions that might well be serious. When the choice is taken to perform a scan, doctors will make sure that the advantages outweigh any risk. Problems that might possibly arise from radiation exposure include cancer and thyroid issues. This is extremely unlikely in adults, and also unlikely in children. However, are more at risk of the results of radiation. This doesn't mean that health issues will result, but any CT scans should be noted on the child's medical history. In some cases, only a CT scan can show the desired results. For a few conditions, an ultrasound or MRI may be possible. Can I have a CT scan if I'm pregnant? Any woman who suspects she is also pregnant should tell her doctor beforehand, because there's a risk that the X-rays could harm the fetus. Citing the American College of Radiography, the American Pregnancy Association (APA) illustrate that no single diagnostic X-ray incorporates a radiation dose significant enough to cause adverse effects in a very developing embryo or fetus. However, the APA notes that CT scans aren't recommended for pregnant women, unless the advantages clearly outweigh the chance. CT scans and breastfeeding. If a lactating, or breastfeeding, mother needs an iodinated intravenous dye for contrast, she should avoid breastfeeding for about 24 hours as may pass into the breast milk. I have claustrophobia, can I've got a CT scan? A patient who has claustrophobia should tell their doctor or radiographer beforehand. The patient is also given an injection or tablet to calm them down before the scan.